Hello, and welcome to Children's Hospital Central California Simulation Pre-Brief Video. This video will briefly discuss the goals and rules for simulation, as well as features of each high-tech mannequin. The three main goals for simulation are to provide a safe environment for learning and self-reflection, to provide an opportunity to train as a team and act in your true role, as well as to improve patient safety and outcomes through team training. We do ask that you follow a set of rules during your time in simulation. What happens in SimLab stays in SimLab. Please do not discuss the simulation outside of the lab or debrief room. This includes individual performances as well as the simulation topic. We ask that you show mutual respect and expect that you will learn from this session. We will ask that you sign a confidentiality form before entering the simulation. The simulation is considered live, and you will be asked to enter into your role and act accordingly. The facilitators are not part of the simulation. Please ignore us. We are not there to provide guidance or help during the simulation. Please treat the simulator as a true patient. For example, if compressions are needed, give them. If fluids are required, give them. If medications are warranted, draw them up and give them in the appropriate route, rate, and dose. If you need vitals, place the patient on the monitor. During the simulation, there may be actors involved in part of the simulation to add to the realism. They are called confederates. Please treat the interaction as you would in a real situation. Do not treat them as a joke. Immediately following the scenario, we will move into the debriefing room where we will spend some time talking about the scenario. You, as the participant, will be doing most of the talking and leading of the discussion. We will talk through the scenario, focusing on team performance, not individual performance. We will summarize what went well and what we would change in the future. For your information, there are no grades or job evaluations associated with this simulation. You may be asked to fill out a short evaluation at the end of the session. We value your comments and feedback.
In a few moments, you will go in to meet the mannequin, and we will review the Zoll monitor as well. We will briefly review the functions of each the mannequin and the monitor. Each of the high-tech mannequins comes with a basic set of functions. They will have vocal sounds, breath sounds, heart tones with associated rhythms, pulses, IV access, and they are also able to have a seizure. Each mannequin is also able to be defibrillated, cardioverted, and intubated. If you need to defibrillate the patient, you will need to use these attachments. This will be plugged into the Zoll monitor. As opposed to a real patient where you would place adhesive pads, we use these for the mannequin. Remember, white on right, snap it in, snap the red one to the left side. If the monitor says check pads, that means the connection to the mannequin is not adequate. Sim Jr. has pupils that are able to be changed but not react to light. He has brachial and radial pulses on his left arm and bilateral carotid pulses. When placing the blood pressure cuff on Junior, please place it on the left arm. Again, there are limitations to what we can simulate. If you need something that is not available on the mannequin, such as capillary refill, laboratory values, or EKG findings, please ask out loud and we will give you the information if it is relevant to the case. Thank you so much for your participation, and we hope you have a good experience with us here at Children's Hospital Central California Simulation Lab.